Hi, everyone. Thanks for joining us today. We're really excited to share with you our labor of love, which is our new textbook, The Leadership for Evidence-Based Innovation in Nursing and Health Professions. Today, Dr. Davidson and I will be sharing with you some of the rationale behind why we needed to write this text and get it into the marketplace, share with you some of the key concepts, and then also share with you some of the differentiators that will allow you to adopt this text into your curriculum easily and actually further leadership conversations around healthcare and innovation. And we're really excited that this is a different text. There's nothing like it out there, and it combines three of the the most important aspects of leadership in healthcare, which is innovation, evidence-based practice, and leadership. So we're very excited. First, I'll turn it over and let Sandra introduce herself, and then we'll go from there. Sandra?
Great. Thank you, Dan. I echo your comments about being excited to share this. It's been a great journey. So I am currently an assistant professor at the University of Alberta in the Faculty of Nursing, but practiced and have taught nursing and healthcare-related topics in both Canada and the U.S. And I guess the biggest takeaway for me is I love nursing education and innovation and trying to find ways to integrate the concepts of innovation and education and leadership all together is that synergy, and I think the book represents that really well.
Great, thanks. And I'm Dan Weberg. I'm currently the Director for Nursing Innovation at Kaiser Permanente, which is the large integrated healthcare system in about 7 states in the U.S. And I'm also auxiliary faculty at Ohio State University and one of the co-authors on the book, and really tried to bring some of the, down on the front lines innovation work to the text as well. So we have a good smattering of expertise on this. Our other authors, you probably know by now, Dr. Tim Porter O'Grady and Dr. Kathy Malik were also authors on this book and really helped Sandra and I, dream up the concepts and wrote several chapters for us. They're both experts in leadership and magnet status and healthcare change and innovation, and so we're very excited to be able to collaborate with them on this. And I believe Kathy's on the line as a participant, so maybe she'll be able to chime in later in the question section. So this text was really born from the concept of combining 2 existing texts. Actually, there's a innovation leadership text by Dr. Porter O'Grady and Dr. Malik, and an evidence-based practice textbook that has been out for a while as well. And what we're finding in both our experience and practice and research is that there's a need to combine the concepts of evidence, innovation, and leadership. And currently how they're being portrayed in curriculum and in the marketplace is, as siloed topics. But when in practice, these concepts actually work together in a dynamic that allows us to lead differently and create the changes needed for a better healthcare system. And, we were so fortunate to have Maureen Bosignano write the foreword from the Institute for Healthcare Improvement. And the whole foreword's theme was and instead of or. So it's not innovation or leadership or evidence-based practice, or what you'll see sometimes is evidence-based practice or innovation, or performance improvement or innovation, but really the concept of and, bringing these concepts together and actually using the best tools from each one of these disciplines to lead differently. And so it's innovation and evidence, it's leadership and innovation. And they're not silos, and they actually work really well together, and that's what this text pulls together across the 16 chapters. So what we're finding, and the reason that we wanted to write this text is that, leadership at the front lines, at the executive level, even at the staff nurse level, is changing. The complexity of healthcare systems is huge. The push for consumerism into healthcare with technology and patient-centered decision-making, emerging technologies, and just the amount of evidence and research and change and data that's flying at our practitioners and leaders is tremendous. And there's not a good framework right now to connect the dots, to help our leaders connect the dots between all of these. And so that was the impetus for creating this book. It stemmed from the shift from a volume to a value-based healthcare system, the Affordable Care Act, and then our experience in leading organizations through dynamic change and the gaps that we've seen in the leadership of these organizations, a text to help fill those gaps and create learnings and activities for our emerging and new leaders coming up through the system. What we're also seeing in practice is that healthcare organizations are beginning to mature. Many of them have an evidence-based medicine or evidence-based practice department. Many schools have curriculum that incorporates evidence-based practice. Many schools are starting to emerge an innovation discipline within their curriculum. Hospitals and healthcare systems are doing the same. They're also combining things like performance improvement and an idea of innovation or design thinking together. And they're kind of making it up as they go along. When there's a large body of evidence, both from a leadership perspective, research on the innovation process and the use of design, and the evidence-based practice literature that can be connected in a different way to help these organizations, these leaders, and these curriculums to think differently and lead differently. And so we actually advocate for new competencies that leaders must have this triad of competency between evidence, innovation, and leadership to be able to lead effectively in the changing healthcare environment. So I'll turn it over to Sandra to dive into a little bit about what evidence-based innovation is.
Sure, thanks, Dan. As Dan was mentioning, most of us are very familiar with the terminology evidence-based practice, as well as the idea of innovation and leadership. And what is a little bit new is the terminology we use, namely evidence-based innovation. And so what is that? How is it different from just plain old evidence-based practice or evidence-based nursing that we're more familiar with? And we really try to set the foundation in the early chapters, and Dr. Porter O'Grady and Dr. Malik do a great job in the first few chapters, really talking about this dynamic relationship that truly exists in practice between the use of evidence and what innovation is or can be. And it's this dynamic that is the central feature in beginning to understand how to lead in a different way, as Dan is suggesting, and that there's multi-dimensional aspects to both the process of evidence-based practice as well as the nature of innovation. And so understanding them as a dynamic is something that's different, and it's really that both and rather than the either or. But what often happens in teaching of evidence-based practice and innovation is that they're dealt with in silos or specific courses. So it's not uncommon for a lot of our graduate courses and even undergraduate to have a standalone course called evidence-based nursing or evidence-based practice. And again, siloing leadership in its own course as well as innovation if that's a piece of your curriculum. So really understanding them as a dynamic is the critical change here. And so this is just a nice graphic representation of that synergy. And so we know evidence and evidence-based practice has certain characteristics. It's factual, it's foundational, it's a product of deep study and indeed research, and it's disciplined in terms of how we develop and integrate the research and the findings. On the other end of the spectrum is the innovation process, which is characterized as being very dynamic, emergent, constantly changing, and generative or synergistic. So, you know, it's not the 1 and 1 equals 2. It might be the 1 and 1 equals purple in terms of innovation and creating something new of very disparate challenges or opportunities. So when we bring those two processes, dynamic processes together, we get this evidence-based innovation. We're not just basing innovation on a whim, so to speak. It's the foundation of it is our existing evidence. What do we know? And what does that mean for how we might think about creating something new or value-added to healthcare? So then, as Dan was alluding to, why is it important to write this text? Again, it's getting at that combination and the synergy of these dynamic concepts. And as we are seeing, there's calls all over the place for a different kind of healthcare leadership, a different way of being that's going to transform healthcare. I was actually just reviewing the AACN website because I'm doing a crosswalk for the essentials for the master's and the doctoral level programs with the concepts in our book, and it fits very nicely, by the way. But one of the things that I have been looking at is the Advancing Healthcare Transformation, the New Era for Academic Nursing, the report that just came out in March. And really what it illuminates is that there's a need or a call at all levels of education to have an emphasis on leadership. And it's getting at this different type of leadership. It's not the traditional mechanistic hierarchy-based leadership that is been ingrained in the way our organizations have run, but we're wanting to do something differently to create a preferred future in healthcare. So it's really about that leadership in a different way for complex healthcare systems, which we know that's what we have, as well as this integration of research into clinical practice. And so those two hallmarks in that newly released report are really represented in what we have in the book. So the text itself then, as Dan alluded to, has 16 chapters that really connect innovation, evidence, and leadership throughout the journey and in different ways and from different vantage points. We have a tremendous team of contributing authors that have different subject interests and areas of expertise that provide those linkages from, from a chief nursing officer standpoint or a union leader standpoint or an educator standpoint. Many of the topics that are emergent and very contemporary, there's a large focus on informatics and what informatics might mean for how we think about what evidence is. So there's, for instance, a chapter talking about big data and personal information that's gathered from individuals, for instance, even a Fitbit. We know a Fitbit gives us information and evidence about our activity, our health, blood pressure, pulse, whatever it might be. And how do we then integrate that into thinking in terms of personalized health information, big data? Is that evidence? If so, how do we work with it to do value-added care delivery? Technology, again, is linked to the informatics. The other aspect that is prominent throughout the text in the way it's organized, in the way we talk about these concepts, is this idea of complex systems and leading within the environment of complexity, and then what that looks like in terms of innovation. The other, I think, distinguishing feature for the book is that we really set out to write this with faculty in mind. As Dan alluded to, we have all taught, so myself, Dan, and Dr. Porter O'Grady and Dr. Malik have all taught these concepts in various programs over the last decades. And so part of the genesis of the book was scratching an itch that we all had for finding the right book that had the right focus and was really user-friendly for faculty. And so as a result, we have a lot of activities embedded in the chapters that help faculty members to really bring these concepts alive for students. Call-outs, we also have done a great deal of work in terms of course guides. So we have the online faculty guide that of course has the obligatory PowerPoint summaries of all the chapters, but beyond that, we also have suggestions for learning activities or enhancement activities, so how you can take the call-outs or the activities that are in a chapter and maybe adapt that if you're teaching an online course, or taking that core activity in the chapter of the book and then extending it to make it into an assignment or something that's more compelling and conversational for students to learn about the concepts. The other piece that's also in there is we have curated additional links and resources that we think really bring the content alive. So for instance, we're all big fans of TED Talks, and there's a huge array of healthcare-related TED Talks that are really representative of the emerging areas that are covered in this book. So we link you to those that we really think resonate with the themes of the book. So in the book itself, it's organized, again, with learning in mind. So there's 4 distinct sections, and it builds on, each section builds on the previous. So the initial one is really looking at evidence and innovation and the foundational relationship between them, and what that means for how we lead. And so using the known to lead into the unknown is kind of the foundational first section. And the second section is looking at how we might support further innovation and thinking about what that is in terms of working from that basis of evidence. So it's building and growing. That is the main focus of section 2. Section 3, we start to look at, well, this is all fine and good and well, but how do we start to measure innovation? How do we start to be able to identify that we have made a change and that that change is indeed value added? So we start to address from various vantage points how we might measure innovation. And again, it's the tendency is, from our very kind of traditional mindset, is to focus on quantitative measures in terms of looking for value add. We also propose in this section that measuring innovation from a complexity perspective might mean something like looking for changes in organizational patterns. So we kind of explore it from a very novel perspective, as well as some of the traditional ideas about measurement. And section 4 really takes it that next step and builds, again, on this foundation that's been set out to really say, you know, what are the next stages here? How do we bring this all together and continue to create even more innovation and even more value added? And again, develop our own capacity to do more of this transformational leadership. The chapter structure I've alluded to a little bit, but each chapter has at least 3 learning objectives at the beginning to guide the learning and kind of highlight what the critically important takeaways of each chapter are. And I think in most cases there's more like 4 or 5 objectives. And as I said, there's multiple in-text activities. Some of them are discussion points, some of them are case studies, and some of them are kind of like a think, pair, share kind of scenario. And again, they're very malleable, so you could easily adapt them in a face-to-face classroom or in an online environment. And as I had mentioned in the faculty guide, we give even more support in terms of adapting things for online delivery or for specific target audiences, that type of thing. And I've already talked about the additional resources, so I won't spend a lot of time on that. The other thing I will just say is that we do plan to continue to add and refine the online instructor resources. So for instance, one of the things I'm currently working on is mapping the concepts in the book to the AACN essentials at the doctoral and master's level. So basically how to use this text, it's really a comprehensive guide in terms of healthcare innovation and as we've said previously, bringing those usually set apart concepts of innovation and evidence and leadership together, and it's a synergy. So definitely we welcome you to adopt the book wholeheartedly, but I also want to let you know that there is the option for the custom text solutions. So depending on, you know, if you already have a curriculum that's well underway and you're looking for certain gaps, you have certain gaps that you want to fill related to some of the content that we've talked about, you may want to pick and choose chapters and create your own custom solution for your particular case. a couple of chapters that we think as authors might fit really well as kind of standalone or additional enhancements to an existing program are chapters like 15 or chapter 14. Chapter 15 really talks about building diverse partnerships in healthcare organizations, and so this actually takes the perspective of a labor union partnering with a large healthcare provider entity, and really how do we make that work? We often think of those two types of organizations being at odds, and so it's a really great example of how those diverse partnerships actually can strengthen care delivery. So that's a particular focus of a chapter. Chapter 14 is really a focus on evidence-based education. So and that's one of the chapters I wrote, and in terms of that, you know, if we want to do something differently in the future of healthcare, if we want to create a new type of leader, we need to educate our next generation of care providers differently. So it behooves us to look at, well, how are we educating? What are our structures? What are our guiding principles in how we do healthcare education? And propose ideas for how we may do that more effectively to get the transformational leader of the future who works from evidence. So we really do see evidence-based innovation, the text, as a hub. And so if you have a program that has the themes of evidence-based practice, some elements of innovation, and definitely leadership as core features, this is a book that really brings those discrete topic areas together. So if you have an existing evidence-based practice book or books that you use in the other areas, the way the text is written and the way the activities and discussions are framed, it really helps students to synergize and to create synthesis and develop their own thinking in terms of what does this look like in real practice when I don't have these concepts siloed, when I'm actually thinking about the evidence for a practice change, and then how do I create that innovative new program that is based in evidence, and then how do I think about what's my role as a nurse or a healthcare provider leading the process of change for this evidence-based innovation. This graphic is actually from, I think, our chapter 16, which is just a nice overview, kind of tying it all together, summary chapter. And as Dan has alluded to, you know, the three core concepts throughout the book are evidence, innovation, and leadership. And the chapters themselves and the sections, we also were able to discern that there are these themes that drive our discussion of those topics throughout the book. And those really are, you know, the whole idea of being patient-centered and always looking for that value add of how do we enhance the patient experience. So that's one element. Of course, we've talked previously about technology and informatics, and that whole realm is another theme that we explored quite thoroughly. The next little bubble there is failure. Tim and Kathy have done a wonderful chapter on the what is failure and how is it a driver for innovation. How can we learn from failure to, in essence, fail forward and celebrate that we got something wrong so that we can therefore learn about it and get it right. And definitely failure is a process that drives innovation. So failure in terms of those three themes is integrated. And this whole idea that I talked about earlier in terms of understanding from a systems perspective and a complexity perspective, how we start to work with patterns in healthcare and how we can use those to leverage innovation and leadership. And last but not least, partnerships. We do have a fairly integrated focus on interprofessional care in the chapters, and that is a theme that is threaded throughout. So we kind of classify that under partnerships, but as well as diverse partnerships that maybe are less well represented in the literature. As I mentioned, labor unions would be a diverse partnership. So I think Dan mentioned early on that we kind of set forth some competencies that leaders of innovation and evidence-based innovation need to develop. And again, this is from our summary chapter to just kind of talk through how we see that those competencies developing and building on each other to really have someone develop as a fully functioning professional that can really lead innovative change from a place of evidence. And so the beginning one is really just understanding the dynamic between evidence, innovation, and leadership. And as I said, the book does a good job of providing that foundation. The next kind of flywheel arrow there that you see is self-leadership. So this is the idea that as leaders, we all lead from who we are, our internal landscape, if you will. And so understanding who we are as leaders, as healthcare providers, as innovators helps shape what we put out into the world. And so that's, again, looking at from a complexity perspective, this idea of self-leadership and leading yourself before you can lead others. The third one is building this innovation competency. So beginning to understand how to actually enact some of these concepts in the real world to build innovation within our practice, within our organizations, and what that might look like, what the steps forward to do that and make it live actually are. And the third one that ties very closely to that is this competency around communication and connection. And from the complexity perspective, a lot of leadership is very relational. And so communication and connections really drive our ability to make change. So that's another core competency. And then the final one is kind of bringing it all together is building that momentum, creating the compelling urgent case for what we're doing and why it's important, and demonstrating the continuous value add of those activities. So that kind of is the ebb and flow of how all these competencies come together to really create sustainable change and transformation in healthcare, from our view.
Thanks, Sandra. So I want to talk just a little bit about some of the specifics around the content as well and dive a little bit deeper so you can get a flavor of what's in the book. You know, the rationale behind the content design was really geared towards instant applicability. So, you know, not only is there theoretical, you know, concepts and themes and you know, talk in the book, but also it's related directly to how can you take this tomorrow and go to work and do something different, or how can you apply a concept or look for a concept as you're working, because we understand that many students in the master's and doctoral programs are working and applying, and many are experienced leaders, and what we want to do is challenge their assumptions and have them think differently on day one when they read a chapter to be able to go in and do something different where they're working. Just to highlight some content that, you know, we've done a lot of research, and like Sandra said earlier, you know, we wrote this book because we couldn't find a book anywhere near it. And so when we're teaching these concepts of innovation and leadership, we needed something that tied these emerging concepts together. So some content that, you know, is brand new to the marketplace and you know, not in a consolidated place is, you know, chapter 1 is evidence-based practice and a framework that connects EBP and innovation together in a logical framework to support leadership. Chapter 4 is all about patient-centered care as a way to innovate in healthcare, create change, as well as what leaders can do to create and leverage patient-centered care to improve the system. Chapter 5 is all about emerging technology, data, big data, analytics, wearables, and the end of the chapter is actually a dissertation, findings from dissertation study about how frontline leaders and managers in hospitals can use informatics to actually make decisions and create change in healthcare. Chapters 7 and 8 are around the complex relational process, patterns, complexity, complex adaptive systems, and how that applies to healthcare. Chapter 11 is one of my favorite chapters. That's all about failure. Not only how do you use failure to move forward, but how do you know if you're failing as a leader, and to do some self-reflection, which is, it's a great chapter. And then chapter 15, something that's not always, you know, tackled in academia, which is, the tension and the collaboration between labor unions and healthcare organizations. And specifically, this one was written by a nursing labor union that works with Kaiser Permanente, and it was written from a labor leader, a partnership leader, which kind of connects labor and management, and then a management leader, all talking about the process of connecting and working through issues in a way to create really effective and massive change for a very, very large organization. What you'll see also is there's core EBP and innovation content, so we get at the core pieces of these disciplines as well. So Chapter 2 is research on innovation leadership using complex adaptive systems theory. Chapter 9 is written specifically about the discipline clinical inquiry, or the DCI method for evidence-based practice, but also taking a lens of how do you use the EBP process to actually inform future novel thinking, a little bit beyond, simply implementing the known evidence, but taking it a step further. And then Chapter 14 was one of Sandra's chapters, which really tackles how do you teach healthcare innovation in a curriculum, and how do you do that differently, which is also applicable to organizations and leaders, because many times we find that these new leaders, these innovative leaders that kind of change their paradigm from the traditional thinking are loners in their organization, and so they have to actually educate differently and come prepared differently to the table so they can spread the new way of leading. So again, this is a little bit different than your traditional leadership text in the fact that it's both and thinking, not or. It's not a management text. It doesn't, have specific ways that you coach an employee through discipline, but it has the concepts of, how do you integrate those type of tools and techniques into a larger system of leading. It doesn't cobble together, like Sandra said. We've had to pick books off the shelf and have 4 or 5 different texts for a course to connect all these concepts together. This book brings it together and is a hub for you. It can be used not only in a single course, but it can be used as a staple for a curriculum, depending on what you're teaching. And we have a faculty guide within the resources that give you the concepts and actually provide recommendations on how you might adopt this into a course, or how you might actually develop a curriculum around these concepts. So we try and give you as many tools as possible to help you integrate it in. And it encourages the big picture. It's not oversimplifying. It's really conceptual with applied, with application of the concept instantly through case studies, discussions, or examples from leaders living this every day. And, we see this text, for all leadership within the healthcare context. The authors happen to be nurses, and we love our profession, but there's only 1 or 2 chapters that actually specifically call out nursing as the only example. So, we wrote it as, for all leadership programs within healthcare. So these are just some ideas of where you might be able to use this text. It is written at a graduate level, so master's or doctoral prepared students would find the most value, although some of the chapters, like the partnership chapters, the education chapters, and a few others might serve an undergraduate curriculum as well, depending on what the focus area is. We also see this as interdisciplinary. Sandra mentioned we took that approach. We do talk about multiple disciplines and the context of leadership in teams. And so how do we create care teams that are different? How do we create systems that work together, not just one profession at a time? So it's applicable across many different areas. We also see it outside of curriculum as well, for those that are leading professional development programs, even continuing education programs, or within a healthcare organization and trying to do organizational development activities. This book provides a really good basis for those type of things as well. We've done some crosswalks. Sandra's working on the AACN crosswalk. I looked at the AONE competency crosswalk, And so what we tried to do is take some of the key concepts of these different leadership certification bodies and standards and just map which chapters hit at those type of content areas, so you can use them depending on how you're going to structure your curriculum. And, you know, we really want you to kind of synthesize different texts together. We're not saying, you know, replace everything you have and put this text in, but this text actually connects the dots with you. And so we've provided lots of tools and resources for the faculty to kind of integrate this in. And so we're really excited to be able to share that with you. And it's a dynamic set of resources as well. When we see new content or new ways to apply it, new case studies, you know, we're hoping to add those to the faculty resources as well. And this is really focused on future. So this is how do you build the future healthcare system. It's not necessarily the leading of now. And, you know, that you'll see that throughout the themes, lots of different emerging topics like big data and wearables and complexity and patterns and those type of things are things that are hitting our healthcare leaders now, and they're not equipped to be able to understand how to integrate them as a source of evidence and to lead forward. And so this book actually takes, you know, those emerging concepts and applies them to how you can have tangible ways to move the system forward. Mm-hmm. And it's a call to action for leaders. So, you know, this is, you know, we have to embrace and what that process is. But with that, I'll open it up and see what kind of questions we might have.
Thank you, Dr. Davidson and Dr. Weberg. Fantastic presentation, and we have a few questions that have come in over the chat. So while we're waiting for some instructors to get in the queue to ask questions over the phone, we do have a few questions from attendees asking about the level of the text. For instance, Kathleen asks if the text is appropriate for an RN to BSN program.
Great question. So I think Dan alluded to some of the ways in which it might fit to a baccalaureate program. An RN to BSN program, you know, as it is generally written for a master's level, but that's not to say that it can't be adapted for a specific leadership or innovation focus in an RN to BSN program. There might need to be a little bit more translation work in terms of connecting some of the foundational elements in an undergraduate program and moving that level of thinking or synthesis, the higher order thinking about what this book presents to them. As an instructor, you might have a little bit more work to do there. So I would suggest probably the best thing is to have a look at the text and see what some of the chapters include. And again, knowing your own particular program and maybe what gaps you currently have or where you're wanting to put some of this content, that you may want to select specific chapters to kind of take that undergraduate, those concepts of leadership and you know, the role, the scope of the nurse to that next level, to the systems thinking level.
Yeah, I agree with Sandra. I think, you know, it would probably be some of the specific chapters would be helpful. I think chapter 1 specifically would be really good. I think chapter 5 and chapter 15, depending on the context of their leadership, would be really good. And then, you know, there's some chapters that really are applicable to leadership no matter what level you're at. And I think those are the ones that you'd want to pick out. And if you want to adopt the whole book, I agree with Sandra. The translational piece would just take a little bit more effort, but we're happy to help with that too.
Dan, as you're talking, I'm also thinking, you know, chapter 4 with its focus on patient-centered and relational care, that's one that I think would totally fit into an RN BSN program or any undergraduate program.
And just to build on that question, another faculty member had a similar question. She's developing an undergraduate degree advancement program in respiratory care, and prospective students will be practicing RRTs, moving from associate degrees to bachelor's degrees. She's wanting to know if she could use this as a foundational text in the curriculum for respiratory care management, research, education, and leadership.
I think again, the concepts would apply similar to the RN to BSN program. I think there would be a number of chapters, probably about, I would say at least half would be applicable to those concepts. You would need to supplement I think some of the specific evidence-based practice type curriculum for that level, because they're going to need to know the specific
foundations.
The foundations and tools to use. But I think this book actually helps connect it together from a leadership perspective and also the team perspective. So I think it definitely could fit into the RRT program.
And Vicki was wondering if the faculty resource guide collection includes a topic on ill-defined problems for use in problem-based learning.
Ooh, in terms of ill-defined problems, we do have some case studies that are actually embedded in the chapters that are what I would call ill-defined problems that you could easily use for problem-based teaching and learning. There's also, again, some of the resources we have in terms of videos and speakers that present a topic broadly. And then students, I could see it very nicely fitting that you could, present a TED Talk and then construct a couple of good questions around, so how does this apply? What do you see the concepts in this chapter giving to solve that problem? So we do have a few that are actual case studies of ill-defined problems throughout the text. I'd say there's at least one in every chapter. But the resource guide doesn't have additional ill-defined problems at this time. And that's, I guess, part of our curiosity in hearing from all of you is what else can we add that would be beneficial to all of you. So I would take that as a personal challenge to think about that as an author and continue to build that repository with some more ill-defined problems.
Yeah, and the other piece is, the activity guides, the faculty guides, are meant to be adapted as well. So, we may have proposed a certain discussion or case with some questions after it, but what we've also done is included our rationale for including those questions. So you can at least see what we're trying to get at from a faculty perspective, and then you can adapt however you want the activity. What we tried to do is focus more on what are the key drivers and points we want to make with the activity, and then allow flexibility for the faculty to adapt it, or they can adopt it as we've suggested as well.
And one more question before we move over to, say, the live Q&A. We have one instructor. She's wondering if this is a standalone text or not, or if she would still need to use an evidence-based practice text or leadership text to cover those other specific topic areas.
So I would say it would be a standalone leadership text for sure. I think if you want to dive deep into evidence-based practice and the process of that, the critical appraisals and the foundations of that, we hit on that. Chapter 9 is actually a pretty detailed account of the discipline clinical inquiry process, but it doesn't dive into how do you search articles and find them and appraise them and synthesize them and that kind of stuff. It's kind of talking at a meta level. Once you understand that process, how do you incorporate those learnings into moving something forward? So you would probably need another evidence-based practice text in the curriculum.
Yeah, I would agree. It's definitely a standalone in terms of leadership and or innovation in terms of how those two fit together. But we do presuppose that there's that foundational knowledge about the evidence-based practice process. So, as Dan was saying, we don't go into this is how you formulate a PICO question, and then this is how you do your CINAHL and Medline search. It's those kinds of nuts and bolts of the evidence-based nursing process would need to be supplemented, but it's then taking that and saying, okay, so then how do you actually do this in a real clinical context?
Do we have other questions, Jennifer?
You do have a question from the phone line from Kathy Malik.
Great.
Hi, can you hear me?
Hi,
yes.
Kathy.
Hi, everybody. I just wanted to say that both Tim and I are thrilled with this work, and just so the audience knows that both Sandra and Dan were our doctoral students, so we certainly support their values and beliefs and their commitment to this work. So Tim is on, and we'll see if we can get him to say a few words in a minute. He has a poor connection, but I think in general, the integration of these concepts exceeded our expectations, and that the scholarship that has emerged from this is really, really well done. So congratulations to you, you both, in really orchestrating this. We both echo the same sentiments about the book. I thought you guys did a great job presenting.
Thanks,
Kathy.
Your next question comes from Dr. Beverly Quay.
Yes, hi, good morning. I am currently teaching a course that has to do with decision-making in the context of healthcare policy and ethics. And I was wondering if you saw this particular text. I've been on the whole call and have really been paying attention to how it's structured, et cetera, but if you saw this as too general of a text for being able to analyze those professional nursing and healthcare issues, specifically around healthcare and legal and public policy considerations and ethics.
Oh, that sounds like a very interesting course.
It is.
and very much needed. You know, I think it would be a very good supplement. Definitely, the issues of ethics and evidence-based policy decision-making are nuanced throughout in a lot of the examples and factor into a lot of the conversations. So I would see it as a nice supplement of, so how do we take some of these concepts of, policy development, advocacy, and ethics, those core concepts, and how does that actually show up in the real world, and how do we use complexity science thinking to inform how we make those decisions differently than we have in the past, or without oversimplification. So I would see it as a nice addition, but I would say you'd need a core policy, healthcare policy resource to kind of bring it all together.
We have two required texts, and they're both the Jones and Bartlett's. One's on decision making and one is on healthcare policy.
Mm-hmm.
So I just wondered, without having seen this book and reviewed it, if, what your recommendation was. So I appreciate that. Thank you.
Yeah, I think the other thing you could do is you could actually dive deeper on some of the policy issues with some of the chapters in Section 4, like the labor union piece, or creating a business case. I think Cheryl Hoying talks a little bit about policies within a hospital that may be restrictive to kind of innovation and those type of things. So that there may be some content in specific chapters that would let you deep dive if you did some of the custom pieces of it.
Yeah, and I think, we have a really great chapter on whole system shared governance that really gets to some of those decision-making models, change agent roles that would fit very nicely to bring the concept of that course home.
Okay, thank you.
Your next question comes from Tim.
This would be Tim Porter O'Grady. And
Hello.
I just had to make sure that I was in the proper line. So I just want to echo Kathy's comments about working with Dan and Sandra. It was a delight. The other thing that I wanted to say, just as a part of the process, is a part of the backdrop for all of this work related specifically to helping people use different models of thinking with regard to problem solving, so that regardless of whether it was policy or decision-making or practice-based or leadership-based issues, that they would recognize that there's a time now to have an entirely different model of thinking and a different framework that they bring to problem-solving and to solution-seeking, and that the tools that were provided here would be useful with regard to that. And I just wanted to add that, and also join my comments with Kathy in terms of working on this text. So thanks.
Thank you, Tim.
Thank you, Tim.
Sandra or Dan, we don't have any additional questions to cover at this time. I don't know if there are any other last-minute things that you want to say before we wrap up the presentation.
I would just send out thanks to Dr. Tim Porter O'Grady and Dr. Kathy Malik for being on the call, but also for their guidance in the development and process of this book. And we have a mutual admiration thing going on here, so it's great that they're here to support us. But also just to, again, illustrate that our information, contact information is up on the screen. We're very happy if you have specific questions beyond this webinar. Please connect with us. We want to make the resources available for faculty as user-friendly and useful as possible, so we look forward to your questions and comments.
I concur.
Great. Thank you, Dr. Davidson and Dr. Weberg. And I want to thank everyone, as well as Kathy Malik and Tim Porter-O'Grady, for joining us today, for sharing your thoughts, and for spending an hour with us. And if you have any additional questions, please feel free to reach out to the authors. If you'd like more information on the custom opportunity that we talked about regarding this text, you can contact our Custom Solutions Manager. That's Dan Sowers here at JB Learning. And you will be receiving a follow-up email from us here that will give you instructions on how you can request a review copy, where you can go to find an archived version of today's webinar, and information about future web events. Thanks very much, and have a great rest of the day.